This is Ed and Pat Sanders saying hello and welcome to African American Health Matters.
Critical numbers of African Americans are dying from prostate, breast, lung, and colon cancer because it's been treated too late. Even more African Americans are affected by diabetes, Alzheimer's disease, hypertension, asthma, high cholesterol, obesity, drugs, and alcohol.
And we are still needing continuing education and more about HIV/AIDS. Our surveys show we need more ways to access resources available in our community and nationally.
There's a staggering number of African Americans who are not aware of drug discoveries that could save their lives through clinical trials. And Ed, we need to educate our people about the importance of clinical trials. African American Health Matters is a mobile health, text message, and multimedia outreach that provides health tips and reminders to subscribers right over their cell phones. And now we have African American Health Matters on Cyberstation USA.
It's health tips for remembering to take your medication and tips on handling everything from diabetes, hypertension, and to tips on losing weight and breaking those bad habits.
You can register online to receive health text messages by going to www.africanamericanhealthmatters.com. That's all one word, www.africanamericanhealthmatters.com. Or you can call our 1-800 number, 1-800-677-8441, and someone will get back with you within 24 hours to get you registered.
Weight and health go hand in hand, and that is why your weight matters. Go to www.yourweightmatters.org. Diabetes health. Regular visits to your eye care professional is a must to prevent problems that can lead to blindness. Hypertension health. A great way to lower your blood pressure and combat the corrosive effects of plaque buildup is to exercise. Arthritis pain. Don't just sit there, exercise. The best time to exercise is when the inflammation is already calmed down. Heart health. If you have a dog, think of the dog as an exercise machine with fur. A brisk walk is good for both of your hearts. Heart flutters. Your heart needs vitamins and minerals that aren't in our diet. Magnesium, calcium, iodine, and B-complex are 4 heart supplements.
The Patient Advocate Foundation CEO and President, Nancy Davenport Ennis, personally became involved in legislative reform when a close friend, Cheryl, was not only battling cancer, but also her insurance company, which refused to cover her clinical trial treatments. While her friend Cheryl bravely fought for her life, Nancy, with help from the Virginia Task Force for Insurance Reform, worked on reforming coverage for cancer patients. In 1994, the task force was victorious with the passage of Virginia House Bill 240. But Nancy didn't stop there. She founded the Patient Advocate Foundation. All of these cases involve patients with chronic, life-threatening, or debilitating conditions. Some need help taking on their insurance company. Others have no insurance, while others have coverage but need financial assistance to buy medicine. None of these clients will ever have to pay for the help they receive from the Patient Advocate Foundation. And the foundation is able to successfully resolve more than 98% of the cases it takes on.
Well, when patients call PAF, oftentimes they have a myriad of issues that they're faced with. What they can expect from us is comprehensive, individualized services designed to help with their immediate need and also identify future needs that they may have as they move through illness back into good health. Our case managers are highly trained, they have diverse backgrounds, and when a patient calls our 1-800 number, they're immediately connected to a live case manager. The case manager does an initial assessment of their needs. We fill in an intake form where we capture all data necessary to work their case, and then that person, that case, is assigned out to a case manager based on area of specialty that will work with that patient from initial intake through full resolution.
when people call us, they're desperate. Every avenue available to them to solve the problem has not worked, and it's their life that they're fighting for. And at the end of the day, you're going to battle to save your life medically, but we don't want you to have to battle to save your life financially and to feel that you're losing all of your integrity and your hope because you can't get the financial issues solved or an insurance issue solved. We can do that for you.
It's very important that the people in this country realize this organization exists and that they know how to get to them, how to contact them, and get the help they need.
For more information, please visit us at www.patientadvocate.org or call us at 1-800-532-5274.
Hi, I'm Jason Snelling of the Atlanta Falcons. On the football field, I face challenges head-on. I do the same when it comes to tackling life with epilepsy. I was diagnosed with this condition while in high school, and nobody was talking about it then. In fact, many people still don't talk about epilepsy because they worry about how they'll be treated when others find out. As a spokesperson for the Epilepsy Foundation's African American Outreach Program, I share my story to end the fear and mystery about epilepsy.
A public service from the Epilepsy Foundation.
Get the facts.
Visit www.epilepsyfoundation.org or call 1-800-332-1000. This is Dori Schatell. We're on Cyberstation USA. Dori is Executive Director for the nonprofit Medical Education Institute. They are partners with the African American Health Matters. The Medical Education Institute conducts research and develops evidence-based educational materials to help people with kidney disease live as fully as possible. She's worked in the renal field for 23 years, during which she's written and edited hundreds of educational pieces for patients and professionals, including Kidney School and the Home Dialysis Central website. She's co-author of Dr. John Agar of the new book, Help, I Need Dialysis. So welcome so much to our show, Dori.
Thank you so
Welcome.
much.
Dori, tell us just what is the Medical Education Institute and what does it actually do for the patients?
Medical Education Institute we're a nonprofit organization, and we do research with patients. So we talk to patients, we survey patients, we interview patients, and we learn from them. And we turn what we learn, along with research, into materials that help other patients to do better when they have kidney disease.
Mm-hmm. Mm-hmm.
Okay. Well, then why should the African American community pay attention to, as an example, kidney disease?
That is an excellent question. Unfortunately, folks in the African American community are at a little bit higher risk for kidney disease than other people. Have a higher level of diabetes and a higher level of high blood pressure. And high blood pressure and diabetes are the two leading causes of kidney failure. So we want to make sure that folks are aware of these risks because they can be dealt with if you know about them ahead of time.
Mm-hmm. Yeah, this is one of the reasons that we're so happy to have you guys as partners, because the messages that we get out, this interview, and we're going to work with you guys to possibly do a few more text messages because our audience is really needing to know about this. So we're very excited. Mm-hmm.
So what can people, Dori, actually do to protect themselves from kidney disease?
There are 3 very simple tests. And if all 3 of these tests are negative, then there's a very good chance that your kidneys are just fine. So you want to know what your blood pressure is. If your blood pressure is normal, and normal might be 125 over 75 or so, or below that, somewhere in that range. Your blood pressure is normal, that's a good thing. If you have a urine test for protein, and there's not protein in your urine, that's a good thing. So that's just a simple urinalysis you can have done at the doctor's office. And then there's a blood test called creatinine. Creatinine is a waste product that healthy kidneys remove. And if your levels are high, that means your kidneys aren't taking that all out of your blood like they should be. If your levels are normal, that should mean that your kidneys are in good shape. So if your blood pressure is normal, you don't have protein in your urine, and your creatinine levels are normal, that says good things about your kidneys.
Oh, that's a good thing.
I'm sorry. I just was going to say the other The other thing you might want to know is your blood sugar normal?
Blood sugar. Now, if any, let's say 2 of the 4 is not right, is that still cause concern?
I would be concerned. I wouldn't panic. But if 2 of those things don't look so good, it's definitely worth talking with your doctor about things that you can do. If you have protein in your urine and maybe you have high blood pressure, there are blood pressure medications called ACE inhibitors or ARBs that actually can help not just lower your blood pressure, but protect your kidney. So that's worth knowing. If you have a higher creatinine level, then I think the doctor's probably going to want to do some more tests to see what's going on, and there may be some specific treatments that can help. If you find these problems earlier, then often they can be dealt with, and the progress of chronic kidney disease, or CKD, can be slowed or maybe even stopped.
So just because one has high blood pressure, one has diabetes, doesn't necessarily mean that they will get it, but they're at a higher risk for getting kidney failure. Is that correct?
Exactly.
Okay.
That's exactly right.
You know, I've known people who've been on, several people, at least a half a dozen in my lifetime, who's had to go on dialysis. Maybe this is a medical question, but what is the extreme that causes a person to have to get on kidney dialysis?
Well, you have 2 kidneys, and each kidney, together they work about 100% if you're perfectly healthy. As we get a little older, our kidneys just naturally don't work quite as well. So the older we are, a little bit less kidney function, a little bit less. If we have diabetes or we have high blood pressure, that can take out enough kidney function that we don't have enough left to live. And when we get to that point, then dialysis or a kidney transplant can keep us alive. So it's good news that there is dialysis, because years ago, even just 50 years ago, there weren't enough dialysis machines to go around, and people would just die if their kidneys failed. I know somebody whose kidneys failed in 1966, and she's still alive today. She's on dialysis, and she's had kidney transplant, and she's doing great. So it is possible to have a good life even if your kidneys fail, but you do need treatment, and that treatment would be dialysis or a kidney transplant, or both.
Now,
not at the same time.
Oh, yeah, that would make sense. Now, you know, we hear about kidney transplant, and it sounds so casual, but that's something you've got to, isn't there a waiting list for people with needing a kidney?
There are actually 2 ways that people who need a kidney transplant can get a kidney. One way is to use the deceased donor list, and the government keeps that. It's an organization called UNOS, United Network for Organ Sharing, and they keep a national list based on blood and tissue type. And it can take a while to get a kidney through that list, depending on your blood type. It might take, sometimes it just takes a matter of weeks or months. Sometimes it can take years. The other source for kidneys for transplant are living donors, and those might be somebody from your church, it might be a sister or a brother, a mother or a father, a daughter or a son. It might be a neighbor. It might be somebody from work. But since we have 2 kidneys, if they're both healthy, and they do lots of tests to make sure that that's true, then somebody can donate a kidney to someone else who needs one. And actually, there are more living donor kidneys transplanted in the U.S. each year now than deceased donor kidneys.
Okay. Dori, I know the Medical Education Institute does a lot of research, but tell us about some of the research you actually do.
Well, the most recent study that we just finished and had published was a study of kidney doctors or nephrologists. We asked them questions about their dialysis training and what sort of dialysis treatment they would choose if their kidneys failed, and a bunch of other questions like that. But what we learned was that 94% of those doctors would choose a home type of dialysis if their kidneys failed and they had to wait 5 years to get a transplant.
Okay.
So that was very interesting, because in this country right now, only about 7 or 8% of people do dialysis at home. And if your kidneys fail and you need dialysis, doing your treatments at home puts you in the driver's seat. It lets you do more dialysis or do it longer so that it's feels more like having healthy kidneys. And in fact, Dr. Ager and I just wrote a book about this called Help, I Need Dialysis, that goes through what it means for your lifestyle how well you might sleep, sexuality and fertility, whether you might be able to work or travel, and even how long you might live based on which type of dialysis you do.
Wow. That sounds really interesting. And that's the book, Help, I Need Dialysis, huh?
Right, and that can be ordered from our Life Options website. It's lifeoptions.org/help_book.
Wonderful. I was going to ask you that. That is perfect. Now, I had a question. The home dialysis, something else that rolls easily off of our tongue, but expense-wise, what kinds of expenses are involved with home dialysis?
That is a great question. I'm so glad you asked that. Home dialysis is paid for, most dialysis is paid for by Medicare. Medicare, there's 3 ways in the U.S. to get Medicare. You can be over 65, you can have a disability, or you can have kidney failure, and you will get Medicare. And once you get it, it covers all of your health care. It doesn't pay 100%, but it pays 80%, which is a lot.
Yeah.
And whether you do your dialysis in a clinic or you do it at home, Medicare still pays, so you don't have to buy your own machine to do dialysis at home. You go right through your dialysis clinic just like you would to go in center. They teach you how to use the machine, and there's a nurse on call 24/7 if you have questions, and they pay for your supplies and rent you the machine, and then they teach you and you do the treatments at home.
Oh, wow.
So it doesn't cost you any more than it would to go in center. In fact, if you live a long distance away from your center and you have to drive there, it might even cost you less.
That's true. That's especially with the cost of gas. You're absolutely right.
I know, right?
And you deal with kidney disease. However, tell us about some of the other chronic diseases that MEI deals with.
We tend to deal with kidney disease. We end up dealing with diabetes a little bit just because it's such a big part of kidney disease. And we've done a little bit with heart disease, but we mostly focus on kidney disease because it's so complicated and there's just so much that people need to know about it.
Okay, well, give our audience your website address and an 800 number.
Oh, goodness. Well, we have 5 websites.
Okay, let's go.
If you go to our Medical Education Institute website, which is www.meiresearch.org, that website will take you to all of our other websites.
That's the main one.
And Life Options and Home Dialysis Central.
Okay.
And we do have a toll-free number through our Life Options program, and that is 800. That is a really good question what that number is, because I never call it myself.
I know.
Will it be on the website?
With that.
That's okay. Find it. We want to do it. We'll edit this part out.
There you go.
Yeah, don't worry.
Truly, I don't ever call that number. I think it's 800-770. Seriously, I don't.
Well, you know what? Don't worry. We'll find it and we'll.
I'll look it up on our website.
Yeah. Oh, is it on the okay? Look it up.
It'll be there, right?
Yeah, it would be on the website. Yeah, we're not at the web right now, but that sounds.
Let me look quick.
Okay, go ahead.
I'm always.
No, don't worry about it. I'm just glad to be able to offer it.
Absolutely, and we take phone calls. We answer phone calls from all sorts of people who have questions, and often the problem is that they are panicking because somebody has told them that they have some level of chronic kidney disease, and most of the time it isn't necessary to panic. Sometimes we do get people whose kidneys basically are at the point where they need treatment, and even then we try to help them not panic, but they're a little closer to panic. Okay, that phone number.
Okay.
Our phone number, our toll-free number is 800-468-7777.
That's 1-800-468-7777. That's an easy number to remember.
Yes, and all those 7s are good luck, right?
You got that right. One last thing. People always talk about you need to drink 8 glasses of water every day, and it'll keep your kidneys healthy. Then recently we found out that body doesn't have to have 8 glasses. It just has to have 4 or 5. So what is the right answer to that?
You are right on the cutting edge of knowledge. That is absolutely right. They used to tell us you had to drink 8 8-ounce glasses of water a day. Actually, these days, good luck finding an 8-ounce glass. When was the last time you saw a juice glass?
That's the truth.
There's no such thing. You know what? Your thirst is a drive in your brain. When you're thirsty, if you drink, that's probably enough.
Okay.
Mm-hmm. Okay. Now that makes a sense to a degree, but some of us don't drink. We get dry mouth instead of drinking. We eat something salty.
Oh, well, that might not be the best.
That's not the best thing to do.
Maybe if you have a dry mouth, you might want to have a little sip of something.
I think.
Yeah, I'm thinking that might be a good idea. And water is a really good choice for drinking.
Absolutely.
Soda, not so much.
Not so good.
Not even the sugar-free. Really best to drink water if you can kind of get used to that.
Yeah. Is it the carbonation in the soda that makes it?
It's not so much the carbonation, but phosphoric acid is a coloring agent in colas, and that will actually pull minerals out of your bones, which isn't so good for you.
Oh.
And I think that they found that there's some mercury sometimes in some of the high fructose corn syrup that they use to sweeten soda.
Oh, okay. That makes
the processing
sense.
that they use to make high fructose corn syrup, sometimes there's mercury in the process, and it can get into the... It's basically not so good to drink that.
No, we've known some of the reasons not to, so I think this discussion is kind of nail that one in. Well, we're talking to Dori Schatell, the Executive Director of Medical Education Institute. You can reach them by going to www.meiresearch.org, or if you want to call 1-800-468-7777. Dori, thank you so very much for your time.
Thank you so much. I was thrilled to be here.
You take care. We'll be in touch.
Thank you.
Bye-bye.
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 Trying to get my ladies back on track. Drop that weight before you have a heart attack. Oh, just like that. Okay, now let's go to work. Shoes, gym, short shirts. Drop that weight just like a hurt. Okay, let's drop that pound cake. Don't look at me with a frown face. You know you need to get it right. Oh, but my cellulite, let's get it right. I got that work. Drop it down, make it work. Pick it up from the dirt, 'cause I don't wanna see you hurt. Ladies to the floor, pick it up, let's go. I don't wanna keep it in, I just gotta let you know. 'Cause I wanna see you live, I don't wanna see you dead. All my ladies, baby, red, let's get your hearts right, let's go. And move to the left, move to the right, turn it around, jump up and down. Move to the left, and move to the right, turn it around, jump up and down. Now get low, get low, get low, get low, get low, get low, get low. Bring it up, bring it up, now bring it up, 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 bring it up. Okay, ladies, here we go again. Time to be your doctor, not your friend. Put cigarettes down, I recommend. If you die too soon, it will be a sin. Now wait, freeze, don't eat that. Fatty foods cause heart attack. Arteries hard like dental plaque. And when you die, you can't come back. Go red, rise, take control. Save your mind, body, and soul. It's never too late and you're never too old. Cross that finish line, take and go. Time for you to exercise. Work your booty, hips and thighs. We hope that you recognize we're red. That's right, we're saving lives. Yeah. Let's go. I don't wanna keep it in. I just gotta let you know. 'Cause I wanna see you live. I don't wanna see you down. All my ladies, baby, red. Let's get your hands right. Let's go. And move to the left, move to the right, turn it around, jump up and down. Move to the left, and move to the right, turn it around, jump up and down. Get low, get low, get low, get low, get low, get low, get low. Bring it up, now bring it up, bring it up, bring it up, bring it
Did you know that African Americans have one of the highest rates of asthma? Asthma is a lung disease that makes breathing difficult for both young and old. Although there's no cure for asthma, it can be managed and treated so you or your loved ones can live a normal, healthy life. You can be as active as you want to be. The American Lung Association can help. Learn more about asthma and keep it under control by visiting www.lungusa.org or call us at 1-800-LUNG-USA.
Many African Americans dismiss the warning signs of Alzheimer's, believing that the symptoms are part of normal aging. Often they are diagnosed too late and miss the opportunity to get the best care possible. This is an even greater concern for African Americans, who are more likely to develop Alzheimer's disease than any other population. African Americans have a higher rate of vascular disease. That means diseases involving blood vessels, including heart attack and stroke. And one of the suspected risk factors of Alzheimer's disease are heart attack and stroke. By working together, we hope to reduce the risk factors and reverse the growing trend of Alzheimer's disease among African Americans.
About 1 in 9 adults has some kind of chronic kidney disease, and it's something everybody should be aware of. How can people know about their own kidney health?
It would be a great idea if they get their blood pressure checked and if they get a regular chemistry panel done when they have their physical, and if their creatinine level's good and their blood pressure's good, and if they don't have any protein in their urine, probably their kidneys are okay. But you can have kidney disease without symptoms, so it's good to have that checked periodically.
We want to thank our sponsors, Dendreon, American Medical Systems, Sanofi Aventis, Genentech, and C.R. Bard.
Be sure to tune in on Fridays from noon to 1 to African American Health Matters on Cyber Station USA.